here is our host, Tian Wei.
Hello and welcome to The Frontline, a World Insight special on COVID-19 coming to you on CGTN. I'm Tian Wei in Beijing. According to the WHO, the U.S. has become the new epicenter of the coronavirus pandemic now. What exactly are the realities on the ground there, and what can be done to save lives? We're bringing together Chinese and American public health and medical experts to discuss the latest. Today, we will be joined by 5 of them. They are in Wuhan, Dr. Fan Junping, attending physician and also critical care medicine from Peking Union Medical College Hospital. In Providence, in the U.S., Dr. Megan Ranney, emergency physician and researcher at Brown University. In Seattle, Dr. David Zhang, FACC inpatient director at CHI Franciscan Medical Center. In Atlanta, Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at the Grady Health System. Last but not least, in New Haven, we have Dr. Howard Forman, Director of the Healthcare Management Program with the Yale School of Management. Dr. Fan from Wuhan, tell me more about the ICU situation now in Wuhan, which is, of course, the epicenter of the outbreak in China. Dr. Fan, briefly.
Well, I'm a resident right now in the ICU ward of Wuhan, the epicenter of China. And we have a setting of 32 beds in total. And right now we have about 20 patients, which are still in a critical situation right now. Part of them are admitted directly by us. Some of them are transferred from other centers. We're still trying our best to save them.
Listen to you, I'm sure, remind some of our colleagues inside the United States as to how they are fighting on the front line. Can I go to Dr. Zhang in Seattle? Tell me more about your situation. The state of Washington, of course, is one of those epicenters inside the U.S.
So in the United States, actually the first case was diagnosed with COVID-19 actually was here in Seattle, I think on January 21st. And since I would quiet down for a while, at the end of February, the first death case reported also in the Seattle area, which in one of the nursing home in Kirkland area. So since then, our case number have been increasing almost a daily basis. And as of today, we reach around 5,200 patients with the death around 220. And that's basically the situation we are now. And we awarded the epicenter, I think still is. However, in the past, I would say in past 4 days, and New York City actually has become the #1 epicenter in the United States. Overall, I think we are fighting with the same disease, same enemy, pandemic. I think I appreciate this chance, opportunity. We can share our experience, learn from our colleague and the frontline doctors in China, Wuhan, and together we can, learn and save our patient, take care of patient, fight this pandemic.
What about for you, Ms. Ranney, the situation where you are and your assessment of the ICU inside the U.S., briefly?
As an emergency physician, I am responsible for all patients who come through the doors of our hospital, those who have COVID-19 and are well enough to go home, as well as those who have to be hospitalized or put in the intensive care unit. We are seeing growing numbers of patients who are admitted to the hospital and admitted to intensive care. We're a little bit behind New York up here in Rhode Island, but day by day our numbers are climbing significantly. And as I'm sure you've heard about on the news, we're facing significant shortages of personal protective equipment, things like gloves, masks, gowns, but also shortages that we anticipate in things like ventilators and other critical equipment to help care for our patients.
Let's take a look at some of the information we have gathered over the days about how prepared in terms of ICUs in each state of the United States. And take a look at this. The country is tackling with the COVID-19 outbreak, of course, according to a study by Professor Adam Sakharny of the Columbia University and Washington Post, New York City's ICU capacity was about 2.4 per 10,000 people. It was ranked 220 out of 305 hospital regions. San Francisco has 3.6, while large hotspot cities that are better equipped, including New Orleans, that has 20.4 beds, and Chicago with 21.1 beds per 10,000 people. I'm sure everybody at the very beginning of the crisis dealing with the scarcity of resources. Dr. Fan, how were you and your colleagues dealing with that at the end of January, early February, which is the most difficult time for China's outbreak?
Well, that was really difficult for a lot of us, especially for those medical staff here in Wuhan. I believe they have been through a very tough time then. We entered this battlefield at the beginning of February when things are getting better gradually. Just because all the provinces outside Wuhan, outside Hubei, has sent medical staff and resources here. However, the patients here was really critical, and there are many of them. We feel a great burden in terms of caring for those critically ill.
At the very beginning in the news, we heard a lot about the lack of resources for the frontline doctors and medical personnel in terms of masks and also protective gears as well. Some of them will also, like their colleagues now in the US and Italy, even wearing the trash bags just to somewhat as a comforting mental protection, but actually could not prevent them from being infected in the ICU. So tell me more about how did you get hold of those equipments?
Well, I believe, at the very first time, there must be some kind of shortage, just because patient boosted up. The patient number accelerated quickly. But we solved this problem using multiple ways. The first one, I believe the production capacity has been immediately boosted up under the effort of the government. Secondly, we have accepted a lot of donations from all over the world. Just because the patients' numbers stopped growing quickly, so the need for, or the demand for PPE, such as PPE, has been shrinked.
Okay, but we have heard also reports, if I could, Doctor, that there are a lot of local hospitals, medical personnel who were infected. In fact, the number is quite huge.
Because I have done some basic surveys to the local friends who are also working in the hospitals. When they got enough information about this new disease, a new virus, they have set up, the quarantine ward, and they have applied appropriate protection setting. So the infection rate among medical personnel were largely reduced.
I see. Dr. Ranney, when you hear your Chinese colleagues talking about the initial stage and also the later stages of preparedness, do you think you are also going through one of those processes, as he just mentioned? What are some of the ways for your doctors and medical people to get access to the material needed, resources needed?
So we face a number of challenges in terms of getting the protective gear. We unfortunately were not able to stock up during the time that Wuhan and the rest of China was going through the worst of the pandemic. And so now, as the disease is starting to rise in the United States, we're all depleting our supplies, and we're unable to refill our supplies at a rate that's adequate. That's for a few reasons. The first is, obviously, many of our supplies are actually made in China, and those were kept in China during the epidemic appropriately, and only now are just starting to come back across the border and be imported. We also now have hospitals and states across the country that are competing to try to get the few supplies that are here. And as a result, many of our hardest hit hospitals are literally running out of N95 masks and other essential protective gear. In response to that, a group of us as physicians have actually created our own website to try to get donations to hospitals and health clinics in need. Dr. Shuhan He helped found, along with me and a group of other doctors, getusppe.org, where we are matching donations with healthcare workers in need, simply because we're not doing, at this point, a strong enough job in the United States of distributing protective equipment where it is most needed. I am hopeful, though, that our government is beginning to step up and activate production locally in the United States, as well as to help distribute protective equipment more effectively across the most affected areas in the U.S.
Dr. Zhang, the state of Washington, of course, has more interactions with the Asian countries, looking at the history. Is the situation there different from what Dr. Ranney just said?
I agree with Dr. Ranney. So we have a similar situation with the shortage of supply of all the PPE. And the only difference that, because I think we were like, the first case was reported here. So whole state of Washington, the social distancing, everything they start pretty early. So far we don't see the number, like we're number climbing, but climbing at a very slow speed. That's the main strategy. The two strategies. The federal government talk about containment, and the other one is the mitigation. I think because of mitigation, so our supply demand problem is not as a big issue, significant at New York and Rhode Island, but we do have similar problem though.
You're watching The Frontline, a special episode of World Insight, bringing you all the latest information, this time about the epicenter of the coronavirus outbreak inside the United States. We'll be back after this. Dr. Ranney and Dr. Zhang, it is not just the equipment, it is also the ventilators. We have heard about the debate between New York, the state of New York, and the federal government about whether it's 300,000 ventilators needed. Putting that aside, how much inventive way are you trying to use in order to come up with the best solution to the lack of it? Dr. Ranney.
So we're working as physicians and healthcare systems with both the federal government and with manufacturers to try to both increase the production of ventilators and to distribute them equitably. We're also working on innovative new solutions, like figuring out if there are ways to use the same ventilator for multiple patients. And of course, we're constantly relying on new science, such as that produced by the folks out of China who've already been through this epidemic, to help guide us in terms of the best treatments that will lower the infection risk for our healthcare workers while also protecting and saving lives of patients.
What about the ventilators? What do you make of that issue? That seems to be a hot debate.
Yeah, so we're predicting that we're going to need up to 1 million ventilators across the United States. Our strategic national stockpile, in addition to the ventilators currently in distribution in the United States, we estimate that there's around 160,000. So we're going to have to either really slow the spread of this disease or get a lot of new ventilators up and running pretty quickly. As I'm sure you heard, Governor Cuomo today proposed that within New York State, that various hospitals all work together and move patients around, so that if New York City gets overwhelmed, that they move patients out into other parts of New York to try to use spaces where ventilators are still available. We're really looking at all available solutions right now.
That is a very interesting solution, Dr. Zhang, because the U.S. System is very different from that of China. You know both ways. China had the epicenter, Wuhan. Everybody run to save Wuhan, bringing all the resources, including ventilators. So Dr. Fan, earlier we talked to, they did not have many problems regarding that. But for the U.S., it's a different story, and we see different epicenters in different parts of the country. So how do you see the situation of ventilators? What do you make of what Dr. Fanny just said, Governor Cuomo's call of cooperation? Is it possible?
Yes, you're right. So I have, I grew up in China, and I know both system pretty well. And so ventilator is a critical, and for the patient go to ICU or for the severe patient with COVID-19. So the reason there's short of supply, and because always supply and demand in the market, right? So I think the three sources we can rely upon, and the current, I will talk about the Cuomo proposal, then increased production and donation and help from other countries, including China. So the way I look at the ventilator, right, I think I was listening to Governor Cuomo's press conference this morning as well. And I would summarize the strategy will like a centralized and decentralized. So what's that I mean? So he mentioned a really good point, which I totally agree, just similar like a China way. So you have so many hospitals in New York and a small number of public hospitals. Either one or combined, either one, they could not handle this crisis alone. So you had a centralized system to share the information, share the stockpile, borrow a ventilator and to help each other. Besides that, right? So Dr. Ranney can comment on that. For me, I always think it's not just a ventilator issue. Yeah. It's all about the staff, right? You need the critical care physicians. You need the respiratory therapist. Absolutely. It's a system thing. It's a systemic work. So we all need the staff. Be trained, be ready to manage those ventilators. Decentralized, I would mean, so decentralized because in the United States system, I would call hotspots because there are too many centers now. So each, like NYC, they could not handle this alone. They probably should send some of the patient out to upper state, lower state of New York, which have a less patient with the COVID-19 called decentralized. And this was not, not done in China because China already contained the disease at the first place. So they did not need that staff. I would use state of Washington, for example. That what exactly happened. You probably know the first, all the cases came from the one nursing home. Yeah. So they basically sent all the nursing home patients to one hospital, quickly disable that hospital. So other hospitals, so what we did is other step up and they shipped the patient, transferred the patient to the different hospitals with the ICU beds. So that relieved the burden of the main one, which is called Evergreen Hospital. Right. So the other hospital all can join this fight. And so far, yes, as far our ventilator, its issue is not as strenuous as a East Coast, but I think so there should be in many ways or we have to be innovative, find an innovative way to fight this virus and also the solve the ventilator problem.
We are getting smarter. However, challenges are always overwhelming. Having said that, though, it is not just the ventilator, as you said, Dr. Zhang. It's also about the staff. It's also about all kinds of resources. It's also about how to make the system work. Dr. Ranney, coming back to you, very critical point. Earlier on the phone, before our show, I was asking Dr. Fan, who is now preparing for his Zoom now, is what kinds of situation he had to deal with in the ICU in Wuhan at the height of the crisis. He said he is one day, one shift, taking care of 9 critical ill patients, all at the same time. One person, 9 patients. That is almost impossible, mission impossible, but they try to do it. So Dr. Ranney, tell me about your situation. What is the smartest way to make the best use of people resources?
So Dr. Forman, who I know is on the show with us tonight, and I helped author a series of policy recommendations actually for the federal government about how best to coordinate the use of staff and equipment and our overall public health infrastructure. We're having a lot of discussions within the United States right now around relaxing our medical licensing rules. Usually in the US, I'm licensed in Rhode Island. I couldn't go help Dr. Forman in Connecticut because I don't have a license in Connecticut. Well, in the context of this epidemic, we're relaxing those licensing so that I can go and help in Connecticut if I'm needed, and vice versa. He could come up to Rhode Island and help up here if needed. Yeah. So that's one way that we're trying to deal with those staffing shortages. We're also communicating among physicians across the United States. We have Facebook groups, WhatsApp groups. We have online compendiums of information to try to share new information as quickly as it comes out, both to save staff and to help our patients. The last thing is, of course, we're worried because of the lack of protective equipment. We're worried about ourselves getting sick. And you mentioned, we watched with great anxiety the reports coming out of Wuhan of healthcare workers there getting ill and even dying. And it is something that we're all worried about. I have numerous friends in the New York City area who have already fallen ill and even been hospitalized with COVID-19.
Yes.
And as our doctors and nurses and respiratory therapists get sick, we're then going to have more significant staffing shortages. And again, I'm hopeful that we'll be able to move folks around between states, but that's only if we can stave off the infection so that we're not all infected at once. Because if everyone is an epicenter at the same time, then there's no extra staff and no extra equipment to share.
Indeed. Another thing is who to save. This is a very cool question, actually. Very cool. But sometimes ICU doctors have to quickly come up to a conclusion as to who to save and to what degree to save. When is it time to give up? When is it time to say, let's continue? How is that critical decision, a very difficult decision, being made in a crisis that is changing so fast every day? Dr. Zhang.
I think that's a great question. Actually, for me, at my job, I'm dealing with that every day because I'm a heart failure doctor and all my patients really sick. Just like this COVID-19, so there's no cure except transplant. Not everyone can get it. So most like common strategies we're using to support is therapy, just for this virus. And sometimes because those patients need all the supports, we call mechanical support, resources are limited. There's a this kind of discussion. So I think for COVID-19 with similar situations, when the system, if we talk of ventilators, when we have enough ventilators or enough staff, so we can handle it. We do not need to discuss this. And however, when they reach the point, we might need. Basically, we're talking about a patient selection, right? So the good thing about a patient selection, I think, is two ways. And when I talk to this patient and their family, I found out a lot of time, they have their own thinking, a decision, how they look at end of life, and they do power of attorney, and someone has the DNR, DNI order already. So those kind of discussion, and eventually, I think when our system is overwhelmed in the United States, we may need more. To be honest, I think we should have the discussion for every patient, every case, if we have time. Involved in the ideal situation, right? So you involve social worker and primary care doctors, discuss with the patient before intubate. Intubation happens. But I heard Italy already have this kind of discussion.
They have long had this discussion.
Yeah,
exactly. They have long had this discussion in Italy, almost from the very beginning because of the situation there. So Dr. Ranney, I want to have you also to comment on this before we wrap it up.
So we're certainly hearing reports out of our colleagues in Detroit that they're already having to make some of these very difficult decisions. And I will say that many of us in the United States are urging our patients to have very honest discussions with their families about their wishes for resuscitation or intubation, about their wishes for those heroic measures, and to have those discussions before they get sick. Because once someone is in my emergency department with COVID-19, they're not going to be able to see their family. We're going to keep them isolated in the ER or even up in the ICU. So it's something that is a big topic of discussion among bioethicists here in the United States right now. And many hospitals are coming up with hospital-wide guidelines that individual doctors don't have to make that tough decision at the bedside of an individual patient.
I see. Before we go, we want to have both of you to answer some questions coming from our netizens. People are watching what you just said. Netizen comments, quote, from this is from @DDAsk. It's not a competition. Politics were not. Ordinary citizens around the world are innocent. Everyone should focus on overcoming this terrible virus. I think this is a comment rather than a question. Just a quick response coming from Dr. Ranney.
I agree completely. This is a time for us to come together, certainly within the United States, but also across the world, because that's really the only way that we are going to combat this epidemic.
Got it. And there's one from Wise Chokuda. The question is whether staying at home and lockdown the best way, tackling the virus. Dr. Zhang, maybe you want to take that briefly.
Yeah, that's a really good question. So in the state of Washington or California, we call it shelter place. I think New York has a similar name. There's discussion again this morning on the Cuomo's conference. I think that question all the time. I think it will work if the home, shelter in place really the community. So everyone follow that instruction to really stay at home, do not go out, and unless it's really necessary, right? If we really follow that, I think that's going to work.
Okay.
End of the day, except in New York and rest of the country, the population not that dense as like China or Europe, right? So that's their advantage. But if they don't follow the instructions, we may need eventually think about like what they mentioned, the Fangcang model, to isolate those patients with mild symptoms together in one place.
All right. Dr. David Zhang, Dr. Megan Ranney, and earlier we talked to also Dr. Fan Junping. Thank you so much. Thanks a million for your efforts to save lives in the emergency rooms and ICUs. You're watching The Frontline, devoted to the fight against the COVID-19 pandemic. Stay with us. We're going to deal with later more situation going on inside the United States, which is described by the WHO as a new epicenter of COVID-19. We'll be back after this. Welcome back. You're watching The Frontline, a World Insight special episode on COVID-19. And now we are joined in Atlanta by Carlos Del Rio, Executive Associate Dean of the Emory University School of Medicine at the Grady Health System. And in New Haven, Dr. Howard Forman, Director of the Healthcare Management Program with the Yale School of Management. And still with us, Dr. Fan Junping from Wuhan. Thank you so much, gentlemen, for waiting for this segment of the discussion. Thank you so much. I want to start by asking Dr. Forman. We heard from Dr. Ranney earlier talking about your joint project, how to help with the frontline situation. Now, how to smooth up the system probably is something you're thinking about every day. Your take here.
We have several problems going on simultaneously. There's a coordination problem at the federal level that in ordinary circumstances we do an excellent job of bringing together resources from across the country. This is something we've done historically over decades. We've dealt with both disasters as well as military wars by bringing the country together and mobilizing our resources, both and manufacturing, to deal with problems very readily and very quickly. And under the current circumstances, what we're seeing is discoordination and a lack of leadership to solve a lot of these problems. Fortunately, we are seeing some private sector and public-private partnerships rising up at the state level. And we're watching our hospitals and local leadership at the city and state level mobilize resources on their own. But this is obviously not an efficient way to do things. And it's something that now we're going to have to continue to deal with in a rolling way over the next several weeks.
Yeah, unfortunately, that is the situation. So let me go to you, Mr. Del Rio. We already talked for several rounds already in the early program, but what is your take of the latest situation? Once again, smooth up the system.
So what the United States is experiencing is multiple Wuhans. We have not one epidemic, but we have outbreaks, and we have epidemics in Seattle, in New York, now in Louisiana, in Atlanta, in Miami. So there are multiple places, and each one of those cities has different characteristics or different epidemics. The levels of testing in each one of those cities is very different. So as Dr. Forman said, we don't really have a US epidemic. You have multiple epidemics that have very different characteristics, and therefore you need some national guidance and coordination, but the response and the way to allocate resources has to be local. So when the governor of New York says, this is what I need in New York, we need to listen to him, but that may not be what we need in Georgia or what we need in California. Each place is a little different, and therefore the control at the local level is really critical in addressing the local needs as an effective way.
Dr. Fan, of course, the U.S. Is a little bit different from China. From your perspective, as a frontline ICU doctor, how to smooth up the system? Any suggestions and any lessons you learned over the past few months?
Well, I believe, first of all, prevention always comes first. Well, a lot of people believe that as doctors and the nurses are at the front line, but actually we are not. We should put the front line to every people. You know, all the population should be aware of that. They are at the first line of this pandemic. They have to adopt appropriate strategies such as hand hygiene, room ventilation, also wear a mask if it is possible, just to stop the virus getting to them and to their family. That prevention always comes first.
How is the prevention work being done, Ms. Forman?
So I think that it took a few weeks, but I think that most of our states and certainly a lot of our more urban municipalities have taken this very seriously. And I think that if you look around now, you see a very different culture and a very different awareness than was present even 2.5 or 3 weeks ago. So we made a lot of progress in that direction. You see the social distancing, you see the hygiene issues being addressed very aggressively. And I think that we're on that path in a good direction. I think the other component of that is the testing piece, which we're not doing nearly as well at, both on a national level and in most local areas. So we're not necessarily on top of where the outbreaks are. We have some sense, but we're not nearly able to educate people as to what areas are the biggest hotspots.
Mr. Del Rio, of course, we know about the new test kits available now. It is said at least 15,000 a day likely to be tested. One could also mail it. So what exactly is the real situation? Because we heard a lot of reports, but people are still saying they do not get the chance to test.
So we still have a problem in the United States with access to testing. We need to be doing 1 million tests a week. And part of the problem is, yes, the kits, but the other problem is just supplies. For example, there's not enough nasal swabs to obtain samples. There's not enough things like, for example, RNA extraction of liquid and material that you need to extract the RNA to do the test. So, and there's also a throughput problem. For example, at my hospital, we have a machine by Abbott that can run 90 tests in an 8-hour period. So well, the most you can do is 270 tests a day, no matter how much kits you have. That's the limit. The limit is the throughput. So we have ordered another machine, but until the other machine arrives, we are limited to 270 tests. So there is an issue. Just people think it's a kit that you just like do it in your kitchen with a, you know, like a recipe. But no, it's a process, and the whole process needs to be looked at. The scale up of testing needs to happen. It's happening slowly, but my goal would be that over the next several weeks, the U.S. could be testing 1 million people a week. And I think we're probably going to get there in the next 2 or 3 weeks.
According to the U.S. president, 100,000 to 200,000 people death, that's the number he's been talking about. As long as within that range, he said it would be a success already in terms of combating COVID-19 inside the U.S. Dr. Forman, do you agree with that?
You know, I think a success is to avoid every possible death that you can. And I think the fact that we got such a late start undoubtedly means that tens of thousands of people will lose their lives prematurely. Everybody loses their life eventually. So it's not a matter of quantifying numbers. It's a matter of how many people could have had a more full and long and healthy life. And we've lost precious time over the last couple of months. But even looking forwards right now, we still have major coordination problems around testing, around ventilators, and about personal protective equipment.
And I would say that the numbers, I don't like to talk about numbers because each one of those is not a number, but it's an individual, it's a person, it's somebody's family member, it's somebody's relative, it's a person. And if it's a relative of mine, that one loss, it's very important. And I don't care if it's 10 or 1,000, I have that with personal loss. So we need to think in the terms of individuals. And I really like what was said about prevention. Each death we can prevent is actually important. It may be a relative of yours. It may be yourself that actually is prevented from dying.
Yes, yes.
Dr. Fan,
Mm-hmm.
maybe not about the U.S. situation because their government and their people going to decide on what approach to take. But from your perspective, I mean, as an ICU doctor, how do you see one life and lives?
Every number behind it, it's an individual, and behind every individual, there is a family. We want to save everyone and every life, just to help their family. But in this situation, in this pandemic, it's a really hard job to do. But we're still trying. Just like everyone agrees, we should focus more on people, on families, less on numbers.
We have some questions coming from our netizens who are sending the questions through various social platforms. One is coming from Facebook. I hope I pronounced this person's name right. Tebogo Church Mochabane. I guess that's the way to pronounce it. So what caused the pandemic? That is still the question.
I think that when a novel virus is introduced into sort of, human community, and it's a naive immune system in the entire world, the ability for that to spread quickly, and particularly which has a fairly substantial asymptomatic period where people are spreading a virus to one another before they even know they're infected, it sets it up for a quick spread. If you're not aggressively testing and implementing all the things that we've talked about from the beginning, you can lose your opportunity for containment, and you're left with mitigation, which is where we are in most of the world right now, is we're in a mitigation phase.
Who came with the name of COVID-19? This is the question coming from the same person.
COVID-19 was a name that WHO came up with, and that COVID-19 is the name of the disease. The International Association of Virology came up with the name of the virus as SARS-CoV-2, and they call it SARS because it's 96 sequence homology to the SARS virus that occurred 10 years ago or so. So we need to think about, but I don't like the name of SARS-CoV-2 because it's too confusing with SARS. So I like to call it the COVID-19 virus, but the true name is the SARS-CoV-2 virus.
Got it. And another question I want to address to maybe Dr. Fan, since this is more related to China. We have viewers asking, what do you make of the so-called debate about the asymptomatic patients? The
virus, in retrospect, is very treacherous and slippery, mostly due to the existence of asymptomatic patients. Those patients who are asymptomatic does not mean that they cannot spread the disease. Actually, they do. Because they live in a community, in a family, also they are shedding virus and making people around him or her get infected. And also such patients, because there's less or even no symptoms, so they are very active. They can live almost normal life. So the activity they participate can be in a very large scale. And that's a very important subset of patients to cause a very severe pandemic.
Dr. Forman, you want to take that question very quickly about the asymptomatic cases. Is massive testing likely to solve that problem? Because we do know there's a delay in terms of when you test and when the result comes out. So would that be the best way to solve it? What is the best way to solve it?
Well, first of all, if every single person assumes that they're potentially infected right now, that can help a lot. So if every person takes personal responsibility and accepts the fact that they may be infected and therefore they should be very careful about who they touch, what they touch, and who they come in contact with, that helps a lot. Testing does help a lot because it starts to identify communities where the outbreak is greater. So a combination of personal measures as well as testing can help mitigate that.
The thing is whether the virus is going to continue to challenge us probably in a bigger way, because the spread that could be coming in cycles. And what would that mean for all of us? Mr. Del Rio.
Well, I think, I don't like to think about that because I don't know if the virus is going to come back in cycles or not.
We don't know.
What I like to think is that science is going to help us. And there's a lot of research happening in antivirals and in vaccines. And if that research continues and is successful, if the virus were to come back, it'll be a very different situation. So I don't like to think about that, because it's like thinking about two different novels, two different books. It's not the same thing. And therefore, we need to support science. Research to create treatments, to create vaccines is going to make the difference in how this virus returns.
We're thinking about the daily battle we're fighting right here, and we're also thinking about real long-term, which is supporting science and research. Dr. Fan, your take briefly.
I believe our whole society, international society, are kind of immunized by this pandemic. All the parts of the society, including medical staff, people, government, and also industry are aware of this pandemic. They know it. And so when things come again, they will be better prepared. Vaccination
at this moment means awareness, right? And the willingness to work together. It seems that the vaccine we already got in hand, whether we want to use it or not and use it smartly, it's really up to us. And finally, before we go, Dr. Forman, also your take.
I just think that we've changed dramatically in 4 weeks, at least in the United States, and I think all throughout the world in ways that we never could have imagined. Just 4 or 5 weeks ago, the President of the United States, many others said the United States could never do the things that China has done or South Korea has done. It's just not the way America can operate. America now sees that they have to change their behavior and they have to work with common goals toward massive testing, to protective equipment, to the development of pharmaceutical intervention, including vaccines. And I think we've changed in that way for the better. And I think, as you say, it's almost a vaccination health in the sense that hopefully we'll never be caught as unaware as we seem to have been in the last several months.
Got it. Howard Forman, Carlos Del Rio, Fan Junping, thank you so much, gentlemen, from China and the US for working 24 hours a day trying to focus on fight against COVID-19. We thank you a lot, gentlemen. Really appreciate it.
Thank you. Yeah.
Be well. And that's all we have for today. Next week, we're going to focus on the city of Wuhan and what's going to happen to that city after that. If you'd like to see more of our program, try to find us World Inside CGTN and also follow us on Twitter, Facebook accounts, and our YouTube channel. I'm Tian Wei on behalf of the team. Thanks for watching. Bye for now.